My name is Thomas Pristo. I'm the Director of Health and Human Services and the Chief Health Officer for the county. And we're here today to talk about COVID-19. Before we get started, I'd like to introduce Supervisor Fowler. And she will give her opening remarks.
Good morning. Thank you all for joining us today. We've been having lots of meetings on this particular subject. We're looking at, we want to make sure that education is out there in all industry, our schools, our public, individual families, to our businesses, and everyone needs to understand what this virus is and precautions to take. In your home, in your workplace, as you travel. We really need to understand how to take care of ourselves and take care of others. You know, elbow greetings to everybody and hi to everyone. I'm a hugger and now I can only do Facebook hugs. So, so we got to really understand what this is and how do we prepare as also at home and in the community, as a community, how do we prepare for this epidemic now it's called. We're in a state of emergency with the state of Arizona as well as Navajo Nation. We at Coconino County, we have not declared a state of emergency, but we want to make sure that information is provided to everyone. So we're looking at economic impact as well. We have companies that were a tourism industry, so we had a meeting yesterday about our economy, the impact. Some of the hotels are getting cancellations, various businesses. Here in Page, we have quite a few tour operators. We're really dependent on these tourists that come through here and stay in our hotels, eat at the restaurants, and then just buy the goods here. So we're all impact one way or another. So today we are here to provide information. We do have the experts here to provide you the correct information and then give you time to ask questions as well. So thank you again for joining us here and on live. Thank you.
We are really happy to be here in Page. We did this presentation yesterday in Flagstaff. We had about 75 folks show up. It was video recorded. So this presentation will be on our website. The one we did yesterday, if you want to go back and refer to it, pretty much giving the same presentation that we did yesterday. As Supervisor Fowler said, the biggest thing that we are doing here is to provide you with information. There's a lot of really bad information out there right now. There's a lot of disinformation. There's a lot of myths going on about this virus. We will give you the facts about what's really going on and the precautions to take and how to move forward. The outbreaks of this type of virus and infections among people are always a public and health concern. The risk to the general public from these outbreaks depends on characteristics of the virus, including how well it's spread between people, the severity of the resulting illness, and the medical or other measures available to control the impact of the virus, such as vaccines or medications that can treat the illness. This is a rapidly evolving situation, and the complete clinical picture with regard to COVID-19 is just not really fully known yet. The illness has shown sustained person-to-person transmission in several geographic locations, and illness has ranged from very mild symptoms to very severe symptoms. Although the immediate risk of COVID-19 infection to people in Coconino County is still believed to be very, very low, it's important to note that current global circumstances suggest it is likely that the virus will continue to spread. As community spread is detected in more and more locations, the need for local preparedness is very necessary. You may have heard the media and many health professionals say it's not a matter of if, but when the illness will reach communities throughout the U.S. Most cases of COVID-19 are likely to be identified in the coming days, including more cases in the United States. It's also likely that sustained person-to-person spread will continue to occur, including throughout communities in the U.S. It's likely that at some point widespread transmission of this virus in the United States will happen. This highlights the importance of all our aspects to be totally prepared and our communities to be totally prepared. I want to introduce Matt Maurer. He's the county's epidemiologist. He's our subject matter expert, and he will walk you through the presentation. Thanks, Matt. Careful about this stuff.
All right, good morning, everybody. Thanks for having me. Thanks for organizing. All the staff out there and community members and Supervisor Fowler, appreciate all you've done. Thank you, Thomas, Director of our Health and Human Services. So, epidemiologist. Usually I get to be in the shadows, behind the scenes, protecting disease. When I'm up here on stage, something's going on. I want to start off with a coronavirus overview. This COVID-19, it's a coronavirus. There's many different coronaviruses that exist within our community, among humans and animals. Most coronaviruses, they do infect animals. On rare occasions, however, these coronaviruses can evolve and infect humans, and then spread from human to human. And that's what we're concerned about around this COVID-19. We saw one instance, the source is unknown, but most likely a virus changed a little bit that was within an animal population. One instance where it was able to infect humans, and now we're seeing that sustained human-to-human transmission. We're not concerned at this point of this COVID-19, the transmission amongst animal to human. We're concerned about the human-to-human transmission that's happening. There are two newer human coronaviruses, the SARS, Severe Acute Respiratory Syndrome, and MERS, Middle Eastern Respiratory Syndrome. These are two more recent outbreaks that have happened that are both coronaviruses. I'll start off with SARS. SARS was first reported in Asia in 2003. The illness spread to more than 24 countries in North America, South America, Europe, and Asia before the SARS global outbreak of 2003 was contained. The symptoms associated with this coronavirus: fever, headache, body aches, respiratory symptoms, and dry cough. Transmission: close person-to-person contact through respiratory droplets. You might have heard that for this COVID-19. According to the World Health Organization, a total of 8,098 people worldwide became sick with SARS during 2003 outbreak. Of these, 774 died. We saw around a 10 to 12% fatality rate with this one. In the United States, however, only 8 people had laboratory evidence of this severe acute respiratory syndrome, SARS, the coronavirus infection, and all had traveled to other parts of the world. Moving along, MERS, Middle Eastern Respiratory Syndrome. This is another coronavirus outbreak. This was between April to September of 2012 is when we saw this one. And most of the affected people lived in the Arabian Peninsula or had recently traveled to that area before coming ill. Symptoms associated with this coronavirus: fever, cough, shortness of breath. Symptom or transmission: close person-to-person contact through respiratory droplets. And then the source for this one believed to be camels, and we still once in a while do see that transmission with MERS from camels to humans. For that one, worldwide there was only around 2,500 cases and about 858 deaths. This one had about a 35% fatality rate associated with it. Now let's move on to our 2019 novel coronavirus. As an overview, this current novel coronavirus, the first cases that we saw all originated in Wuhan, China, in the Hubei province. And all those original cases had ties to a market within Wuhan. There was a live animal and large seafood market in that area. As more and more cases came out, there was less association with that market, and that's where we were able to identify that there was human-to-human, person-to-person transmission with this virus. What do we know as far as symptoms, transmission, and our testing capabilities at this point? Symptoms, the most common symptoms that we're seeing are fever, and then associated respiratory symptoms of cough or difficulty breathing. This virus does not distinguish itself very well based on symptoms alone. There's a lot of other respiratory illnesses circulating around, influenza, RSV, a lot of other colds circulating around. Makes it very hard to determine if somebody is sick with this virus, the COVID-19, based on symptoms alone. Our transmission, person to person through respiratory droplets. At this point, it is unclear exactly how close, but the CDC is estimating within 6 feet. The CDC has also developed testing to identify this virus within patients. At first, they were the only ones capable of doing this testing. It is now expanded out to states. States have the capability too, and we have a testing matrix, those that we see at high risk for this illness. And now commercial labs are up and running with their tests as well this week. So we have a variety of different areas and capabilities when it comes to testing people for COVID-19. All right, let's look at a little bit of situation summary related to this. So I should have introduced myself further, epidemiologist, but I'm also our incident commander for Coconino County and also the operations section chief for this outbreak. Currently in Coconino County, we have 0 confirmed cases. We have 1 negative test, and we have less than 5 tests pending that we should get results for shortly. If there are any of those that are confirmed, everybody will be aware. We have press releases planned, we have press conferences planned, and we will make sure everybody is aware. And just because we do get a case does not mean necessarily that that risk of transmission will change. It depends on how that person obtained that virus. Did they travel somewhere with known transmission? Did they come in contact with somebody who had it? Do we know how they got it? Or is it unknown? And do we start to see multiple cases of unknown transmission? That will help us determine if we are seeing community transmission. Right now, with these numbers and where we're at in Coconino County, we consider the risk of transmission to be low for COVID-19. That is our current situation. Arizona, as Supervisor Fowler was talking about, declared a state of emergency yesterday, along with Navajo Nation. We've seen 9 confirmed cases, 3 of those in Maricopa County, 5 of those in Pinal County, 1 in Pima County. This is as of yesterday.
What did you say at the beginning of that?
We'll see what happens yesterday. As far as the declaration,
About the Navajo Nation?
oh, Navajo Nation and the state of Arizona have declared emergencies.
I was of the opinion that IHS sent out an email, or the Navajo Nation Department of Health Services sent out an email yesterday saying they had 3 possible confirmed cases.
So what that would mean is that those are pending tests. Yep.
So,
Yeah. So with Navajo Nation, and there's a lot of information that's flying around. I get communication right now from NAU, FMC, lots of different community organizations, people working at these saying, oh, I hear we got a confirmed test over here. Oh, I hear we got people getting tested over here. There's a lot of chatter going on. Testing is not happening without us knowing about it. A lot of these potential cases that we're hearing about are people that are themselves concerned about COVID-19. And once we go through it's an easy questionnaire with them, we realize you most likely do not have it.
so
That's what's happening right now.
So then, is this interactive? Is that okay?
Yeah.
You can ask questions?
Yeah,
So
let's do it.
Then maybe something that would eliminate that is if organizations like us, in this room, and individuals in this room, knew that there was 1 or 2 or 3 responsible agencies for reporting that.
Yes.
Is there?
Yes.
Who is that?
Yes. So the County Health and Human Services, Arizona Department of Health Services, and the CDC are the ones responsible for reporting
That's
confirmed
who we
cases.
should be listening to.
That's who you should be listening to. Those are the websites you should be going to.
Thank you.
Yes, thank you for bringing that up. And we are currently in the process of updating and making our website much better, much more robust. That's the word I want. Yeah. We've a lot of times relied on the state or CDC, but we are getting organized, and we are going to be having a nice website that is showing good information for Coconino County residents and visitors and travelers that are coming to and through Coconino County. So as I said before, the current risk, this could change it at any time. It depends on a lot of factors related to, as we start to see cases, how those people became infected, where they're infected, how are we seeing these clusters? Is it able to be contained easily, or is there community transmission, widespread transmission in the community? That's what will dictate our risk factor within Coconino County. A situation summary related to the U.S. From yesterday, a total of 938 cases, confirmed cases. Where we're seeing most clusters within the U.S., most areas of transmission are within 3 states: Washington, New York, and California. Washington State, that is. These areas are seeing community transmission of this illness, and they're working with the CDC. They have containment strategies, very detailed containment strategies, and it's right there on the CDC website. It's very good information to see in areas where there's widespread, or not widespread, but community transmission within these areas, the strategies that they are using to contain this virus within areas of community transmission, which currently are Washington State, New York, and California. Total deaths associated in the U.S. at this point, as of yesterday, 29, and there are 39 jurisdictions reporting cases, including the District of Columbia. Our recent figures out of China. Total cases, 80,955. They have been by far the leader in the number of cases, particularly because that's where it originated. The good news on this, between the one day to the next, the 10th to the 11th, so today is the 12th, but the previous 2 days, a one-day difference, only 31 new cases out of China. That is a change from 45 cases the day before, new cases, for one day, which is a change from when they were at the height of about 4,000 to 5,000 new cases in one day. So they are very much on the back end in China. However, globally, we are starting to see increases of cases around the rest of the world. Outside of China, a total of 37,367 cases. The majority of those where we're seeing widespread transmission is within South Korea, Italy, particularly Italy. I'm sure you've been hearing a lot of information about Italy. They are locking down, the borders are being closed down. Iran, France, Germany. And yesterday, the president announced that we are going to be limiting travel, excluding travel to people coming from European countries to the United States in response to the increasing number of confirmed cases in Europe.
Is that going the other way about people traveling from the U.S. to Italy?
Well, Italy itself, yeah, they're not letting anybody in, they're not letting anybody out. They're on lockdown in Italy. The rest of Europe, I don't know that that's the case as far as traveling to those countries.
Can I ask you a question?
Sure, Kate.
Where are they seeing that in California? Is it like any
So,
particular area?
yeah, the majority of California cases are Santa Clara County. The majority of Washington State cases are Seattle, King County.
Santa Clara's kind of like north of LA, or?
Right around there, yeah. Yep.
'Cause I have a granddaughter that went out there for spring break.
And
Not
a lot of
there,
and a lot of
Santa
these clusters are having to do with specific areas, and we're not seeing this community-wide transmission, widespread transmission.
I haven't seen it.
We're seeing community transmission, but we're not seeing widespread transmission within these areas. Clusters are popping up. I want to reiterate about that transmission. That transmission has really been identified as respiratory droplets. At this point, it is not a huge concern unless we're doing a medical procedure of this virus becoming airborne. It's more so contact with those respiratory droplets. So, for all my first responder folks in the room, the current advice right now, if you come across somebody with respiratory illness, that is the time where masks are being recommended, surgical mask on the person who has the respiratory illness, surgical mask on yourself, transport that person to the facility, and then clean down and sanitize down the transport vehicle. That is shown to be the best current protection right now. It's going to prevent those respiratory droplets from getting out from that person and prevent the spread of that virus to our first responders. Responses.
Just real quick.
Yeah.
The respiratory droplets from a cough or just from normal speaking?
Cough, sneezing.
Cough,
Yep,
sneezing.
yep.
So it's actually the
any of those
expulsion of-
actual expulsion of those fluids.
So it's not
Touching
just a
and
regular.
touching your
And,
face.
yeah. And so then the direct contact is the highest risk, and then a little bit lower risk, but still a risk, is that indirect contact of it ending up on a surface. How long can this virus survive on surfaces? It's still under investigation right now, but we've seen anywhere from just minutes to a couple days. A couple days is more so in that perfect environment, dark, humid, has cells, lots of cells to survive on. But as far as a dry, sunlit, especially the sun, really kills off viruses. Viruses altogether are very wimpy outside the body, and it takes quite a bit for them to survive. But that is a risk of that indirect contact of surfaces, which is why we are recommending to sanitize and wipe down those surfaces.
Explain indoor, outdoor.
Yeah, and then, since it's that respiratory droplet, the higher risk is indoor environments, close contact in indoor environments over a period of time, and outdoor environments are much less risk for transmission of this virus. Yes?
Yeah, Matt, just kind of a funny question. Knowing what you do for a living,
Yeah.
just out of curiosity, are you surprised that Vegas isn't just blown up with this?
A bit surprised, yeah, with how much travelers yeah. I figured it'd be California, New York, and Vegas. That was my prediction. I was close. California, they get everything. So, response-wise, the CDC is continually monitoring this rapidly evolving situation. They're putting into place travel restrictions. I mentioned some of those. Most of the restrictions have been from China up to this point, where they're restricting travel to 11 airports and monitoring, quarantining. A couple of terms I'd like to get straight. Isolation is for the ill. We are isolating sick individuals. If you are sick right now, we are asking that you self-isolate yourself. If you are potentially sick with COVID-19, we want to have that discussion, your healthcare provider, healthcare professional, to determine what is your risk factor for COVID-19. Those risk factors, once again, are travel to an area with transmission, with community transmission, or contact of somebody who has a confirmed case of COVID-19, contact of somebody who has it. If you do not have those risk factors, you are at very low risk for your illness your symptoms being COVID-19. There's a lot of other illnesses circulating around right now. And providers are getting inundated with people wanting tested for COVID-19 when by and large, they don't have it. They have something else. It is very tough, as I said, to distinguish. So we need to utilize those factors associated with your risk, travel, contact, to assess whether there is potential of you having COVID-19. Yes?
Okay, I'm probably going to start in panic mode by asking this.
It's okay.
We have a very, very high level of tourism in this area. There's no guarantee that we've been in, that we know we've been in contact with somebody who has been diagnosed positive with this, are you contagious even though you're asymptomatic?
Yeah, so that's some of the information that's floating around and really a big part of misinformation about the asymptomatic spreading. So the research is being conducted to determine when people are symptomatic with this illness. And just because there's a couple of cases where it might have been identified does not mean that that is by and large how it happens with most of it. So we're still looking into the asymptomatic spreading with this virus. The main concern right now coming out from the literature is saying that primarily people are spreading it when they're symptomatic, but we need to be careful for that asymptomatic spreading.
I read on the
because it's
CDC website, it was like symptoms within 6 hours up to 2 days is that really critical, highly contagious period.
Yeah.
Is what I read on the CDC
Yeah,
website.
so when this virus infects you, infects your cells, and starts to reproduce, at first it disguises itself from your immune system. We're not sure at that point if you're shedding the virus. Most of the time for most illnesses, you are not shedding, meaning contagious, until you start to experience those symptoms, which is your immune system recognizes there's enough of this organism within your body to elicit an immune response. And once your immune response is your actual symptoms associated, and for the most part, for most illnesses, that is the time that you are contagious. Now there are other illnesses, which is why we're being very careful surrounding the asymptomatic transmission, to where you are able to transmit it without being symptomatic. And so since it is still under investigation, I don't want to say one way or the other, but as far as typical illness goes, that you're oftentimes most contagious while you're symptomatic. Yes.
About 5 weeks ago, my wife and I and some people at work got pretty sick. All of us caught it from someone, and it was a lot of coughing, a little bit of fever, and just an overall sick feel for about 3 or 4 days. And my wife was suggesting, well, that means that we come in contact with the coronavirus, that we may be immune because of this offshoot illness. Any chance that's true?
Yeah, so we're not even sure about reinfection right now. The evidence is under investigation right now to determine if there's reinfection for this COVID-19. There's been a couple instances, but it hasn't really been seen throughout the world to have reinfection. Most people that have been infected have not really seen reinfection. And so once you do get infected, there is a matter of building up that immunity. The reinfection part is each time this virus gets passed along, it's changing a little bit. So researchers are analyzing the genetics of this virus to determine how much it's changing. And they're continually doing that research, and that's what's going to add to this, to the reinfection aspect. You need to get this virus to build up that immunity. Nothing else that you're infected with is going to build up your immunity to this virus. And by and large, there's only 2 ways for humans to build up immunity to this virus: to become infected with it or to get vaccinated against it. Those are the 2 ways for us to build our herd immunity, which means the population having immunity to this illness so we don't see this widespread transmission. And we are still a ways out from having a vaccine to fight off this virus.
One more fact, on a totally different subject.
But it does not tell us how it's going to act in the U.S. because we have different sanitation, we have different public health intervention strategies.
I don't know if you answered this question or not. You very well may have, but I'll ask it in a different way. I run a healthcare with one of the most helpful organizations in town. I've been asked this question double-digit times and can't answer it. And by the way, I have looked at 3 different websites and they all answer this question differently.
Okay.
And that is very simply, if you had this 5 weeks ago and you self-quarantined or did whatever to get over it, would you test positive for it today?
Yeah, so that is a huge component to having testing. And we need more testing. We need to identify more cases. They're coming up with serological tests. So right now for diagnostics, we're doing nasal passages, NP, OP swabs, rapid tests, and sputum. So we're looking at respiratory specimens. But they're coming up with blood tests to determine who has elicited an immune response against this illness, so we can get a better understanding of overall who's been infected, and that's going to give us a better idea related to that question that you had. So these are things that are going to come out as we do our epidemiological investigations, meaning we get enough cases, we get enough evidence, and we start to do the research associated with those who have been sick to start to answer questions like that.
Okay.
Yes.
I guess you would probably want to be careful with that response right now because you don't want people that were sick enough to go to inundate the ER
Yeah.
right now in our town.
But what I will say is just because you test positive for an illness does not mean you are contagious. Those do not have a symbiotic relationship. So if that helps you at all, great. Great question so far. You probably could have just done a question and answer period. But again, I have to do a presentation. Let's see, where was I? So national response, check that CDC website, check their recommendations. At Coconino County, we're following both CDC recommendations and guidelines. The CDC has guidelines out for the nation, which are at all different risk levels. Arizona Department of Health Services is giving us very good, more close to home intervention strategies and recommendations, which we are following. And with that guidance, we are working very hard to get it out to the public, to organizations. During our presentations, we've established liaisons for every single type of organizational group out there, every type of community group out there, and those liaisons are going to be responsible for not only delivering information, but also gathering information to make everybody feel comfortable with where we are at in Coconino County and what people can do. And I'm going to get into that as far as what people can do here very shortly. I'm going to give you some meat. So the state response. Lots of stuff happening at the state. They've activated their emergency operations center, which means that they have an incident command structure that is all organized in one place, and they are continually gathering and information, trying to understand the risk levels and understand this illness and get that out to the people who need it, which is all of us. The World Health Organization declared this a pandemic yesterday. We are now in the midst of a global pandemic. They're updating healthcare messaging and prevention and containment strategy guidance. They're hosting calls for all county calls, all partners, counties, tribal partners, all groups that are helping in this response and aiding in this response to give us the most current, up-to-date information, the best guidance that we have at this time. Assisting counties and like I said, in tribal partners determining suspect cases, and also with specimen transport to both their facility and then forwarding on to the CDC for confirmation. When you look at this at the state website, they have both presumptive positive and confirmed positive. Both of those we consider positive cases, confirmed cases. Presumptive means it tested positive at the state health department and they're sending it on to the CDC for confirmation. But we treat a presumptive, we treat a test at the Arizona Department of Health Services as a positive because they have the exact same capability of testing that the CDC has. It's the exact same test. Not necessarily capabilities or capacity, but the test itself. We've heard from ADHS that they can test about 400 to 450 specimens in a day. And then providing public resources. They have webinars for each type of community organization. There is guidance as to preparation and response for each different organization, whether you're part of EMS, first responder personnel, fire, whether you're a healthcare provider, whether you're a school, whether you're a college or a university, whether you're a business, a nonprofit organization, a faith-based organization, a variety of different organizations with specific guidance for your type of organization within the community, and how you can prepare and what you can do right now. Coconino County, we've activated our incident command team. We're working on establishing an emergency operations center with our joint information center and call centers as well, is all getting those up to speed this week. And we'll activate those either early next week or once we get a confirmed case. Yes?
I'm sorry to keep asking so many questions.
No, it's okay.
Do you have on your incident command team for Coconino County representation from the community of age that's 2 hours away? Would it be beneficial to have something?
Yes, right. We are in contact with our page office
Awesome.
right there, and we will be continually updating. Yeah, please stand up. Introduce yourself. What's that? Yeah, and then as well as to the city.
Do you have someone, I assume so, but with Tube City Regional, I'm sure you're all in contact.
Yes,
right?
we are. We're in contact with providers over there as well as infection preventionists, and exchanging information and guidance materials, and making sure they feel comfortable with a COVID-19 suspect.
So I just want to add that we are, Coconino County is working with all healthcare providers, and a large number of citizens are Navajo, so the Navajo Nation, and the first responders. So we're trying to reach out to everyone. Thomas and his team have done a really great sweep across the county and beyond, just to make sure that we're very inclusive. Now, if you know of someone that we're not reaching out to, please let us know so that we might be able to include them in the meeting. We're now, I know from the chapter officials, we're now working with the Animal Vendor Association, who are the people that are along the highway selling. They have an association, so we're scheduling a meeting with them. That's how far we're trying to reach everyone. So just want to let you know.
May I respond to that?
Uh-huh.
That's fantastic that you're doing that. Recently have held some joint meetings with our local community health center, Encompass, and the Page Hospital, all of the CEOs to talk about what our plan is. You talked about tourism. They can shut down. They'll have a huge financial impact on themselves and the community, but they can shut down. We can't. I provide services to all kinds of substance abuse clients, all kinds that need Suboxone, et cetera, all kinds of mentally ill people, all kinds of suicidal people, et cetera. And Page Hospital Candidates is the same thing. It's not an option for us to shut down. What is an option right now, and the message needs to be delivered to the higher-ups, including the Department of Health Services, Access, and Department of Health and Human Services, or SAMHSA, or CMS, or whoever. We all get funded in a variety of different ways. We are already seeing fewer people in our offices that are saying, I don't want to leave, I'm just going to stay at home. And there's not an option for them to stay home, or for us to not provide services to them. Yet, if we can have contact with folks like you to deliver messages to those people to say, for a fiscal year or whatever, you all need to look at the way that you're going to fund providers like me and others. Because again, it's not an option, but if I can't get paid, I can't pay people. If I lose 30 out of 100 employees, it'll take me years and years to recover from that, and people will not get the services that they desperately need right now. We're looking at things like laptops, with cameras on it. We already do telemedicine. We're trying to meet with Access to say, release the limitations of using a cell phone, because I don't have 45 or 50 laptops for counselors and case managers. Can we just use a protected end-to-end cell phone? Well, if I do that, it's $60 an hour less reimbursement. I'm going to lose. And somehow this message has got to get delivered. I have a meeting at noon with our funding source to talk about this. It's got to be delivered because they can't shut down. They have to be there. And I don't know how their funding stream works, whatever, or what have you, but it's going to impact us gigantic. Park Service can't say we're going to have work furlough for a while, not have somebody out there pulling the drowning people out of the water, what have you. I mean, there are some serious impacts for everybody, of course, but for health services and welfare services, it's going to have a gigantic impact. Sorry to be long-winded, but I know you, and you represent this community extremely well, and you have gigantic ties down in the Phoenix metropolitan area. And this message has got to be delivered to those higher powers, those higher authorities, to say, if you continue to fund the way that you are going to fund, there will be gigantic layoffs of health and social services agencies, and it's not an option. It's just not an option.
And this is the reason we're having these meetings. We need to hear from you. What are you seeing and what do you perceive in your organization? And that way, we can advocate on your behalf. So please ask your questions. Let us know what you see, and that way we can better equip you with information and be able to advocate on your behalf. So I want to thank you for bringing that up. And I know that internally we all have to figure out how are we going to handle this. And that's what we're talking about at our internally in the county. If there's someone that is tested positive, then what does that mean? If a number of employees have to stay home, what does that mean? How are we going to be prepared for it? Are we doing paid leave? Do we have enough? Do we have, what is it? What are the internal protections that we have to put in place? So, yeah, it's a big question.
And so we have, for Coconino County, have two sides to that. We're leading the response with collaboration and bringing all the community together and giving guidance and obtaining guidance and listening to updates and assessing risk and identifying cases, or getting to our objectives here shortly. And then there's also the other aspect from the organizational standpoint, which is the same position you're coming from. Yes. And so, yeah, we need to get contacts. We get in contact. It sounds like you're a mental health facility, right? And so we've established that as one for reaching out to and gaining the understanding and the concerns, and being able to provide. We're having about 1 or 2 people per organization that can help with these exact issues that you're referring to. Thank you. So in Health and Human Services, the response started off with our epidemiology program, communicable disease, emergency preparedness, PIO, finance, and at this point we are expanding to involve lots of different partners throughout within Coconino County: emergency management, public affairs office, our IT program, our human resources program. We're talking about some of these issues we're talking about now, as far as the personnel and how are we going to structure, how are we going to continue, what's going to be our continuity of operations surrounding these events. And that all depends on how bad that gets. We're seeing lots of different responses from around the country and around the world altogether. We're seeing lots of different levels of infection for this virus. And so we're going to make the responses based on those recommendations for that level of risk within our community. So our objectives, what has been seen from multiple people, World Health Organization, CDC, that have been working with people affected by this virus, by COVID-19. Number one, we need to identify cases. That is one of our best. Isolate the sick. We really need to isolate the sick. We need to isolate the sick who are not even sick with COVID-19. If you are ill right now, we are asking you to stay out of the public. And that is going to have, as you said, on tourism, a negative effect. A huge negative effect. But what that's going to do is keep sick people from coming into our communities, which at this point is more important. There's the economic side of the whole thing, and we're going to have people focusing on that. My role is to make sure this thing does not spread and to contain it. That is my job. That is our job. That is the job of the community. We need to work together to make sure this thing is contained and does not spread. We need to quarantine those exposed. Anybody that's exposed to a confirmed case, we're going to quarantine. We're going to make sure they are socially distanced out of social environments. For that 14-day incubation period that we've seen. I saw some studies on that recently. 2% of people had less than 2 days as far as the incubation period. That means symptom development. The average was about 5.1 days to start seeing symptoms from the time they are infected. And over 90%, over 95% of people had symptoms appear within 11 and a half days. So that 2 to 14 days is a very excellent time range for the studies that we're seeing. Yes?
Okay, I'm probably going to be a thorn in your side on this. Because there are two main criteria that are being used to identify cases for testing. A lot of us here don't travel to the areas that have been identified as having this explosion, so to speak. And because we work in service, because we work in hospitality, we don't know if we've been exposed to somebody who had this. So how are we going to be able to get tested to identify those cases? Because if you look at this community, we don't meet that criteria.
Yeah. So as I said before, at this point in time, chances are you get sick. We're not going to test unless you got to be sick or something. Because it just doesn't make much sense to put everyone at risk with collecting specimens and testing if you're not sick.
Right.
So you got to be sick. And then from there, there's multiple different criteria for the state testing, which has to do with travel and has to do with contact. Or there's another one where we're getting the most severe cases, to where if you're hospitalized and you have an unknown illness, so we went through, did a respiratory panel, and we're not able to identify a known cause, then that's another reason for testing as well. So there's about 4 different criteria that we're looking at for the state testing. With commercial laboratories, for commercial laboratories, these are paid tests. So there is no criteria for testing. It's a discussion between you and your provider to determine if you're going to send a specimen to a commercial lab for testing. And then we are extremely lucky in this community because we have a state-of-the-art, world-class genetics lab, translational genomics lab in Flagstaff, Arizona. And they are working with partners within Coconino County and even outside Coconino County within the state. And what they are doing for us for public health surveillance purposes, public health surveillance meaning to identify the potential for this illness to be in our community, they're taking negative respiratory specimens that were collected for our potential of flu and other respiratory illnesses. And they are taking those specimens and they are testing them for COVID-19 just to get an idea of the circulation of this within our community. And we're using that as an amazing tool for part of our surveillance, public health surveillance, in the background to work on identifying the risk of transmission. And that got started this week. It's amazing assistance to really identify the risk associated with our community. And is that virus here or not?
I might be able to
Great.
by asking you a question.
Okay.
Is it mandatory for any employer in this community or elsewhere to report to you or to the Department of Health Services or to whoever if they send somebody home because they have been in another location, say Texas, in a training?
Yes,
What
so-
about people that have tested positive?
So as far as tests, that needs to be reported, yes? I am not sure if this declaration, I still need the specifics of it, if that's made it mandatory. So I don't want to quote that term to know if it is. The state is at least working on that. There's about 80 to 85 mandatory reportable diseases that we're continually looking at, that healthcare providers need to report if somebody is infected or is suspect of it. And this, if it's not included yet, which I'm not sure the language behind it, if it's highly suggested or if it's mandatory, it might be mandatory at this point. I'm not exactly sure. And then as far as travel goes, so that's a confirmed case, right? Confirmed case needs to be reported to us, because then what we do with that information is we really, before there's a confirmed case, there's not, now that commercial labs are testing, they'll test, but they still want health department approval. State labs will not test without local health department approval. So if a provider sends off a test, a specimen to get tested, then they're just going to have to wait until ADHS gets contacted, and then they can contact us, and then we have that discussion, why are we doing this? So it won't get tested without our approval of the state. The reasons for that are the public health interventions here. It's not so we can know, so we can be aware. We need to know so that way we can respond with our public health interventions of doing that investigation to figure out where were they, what's their risk, who did they potentially expose in the last 2 weeks if they've been traveling around, who are the high-risk contacts, who are those that we now need to quarantine. That's why those illnesses are reportable. So that way we can conduct our public health interventions of what we call contact tracing. Identify who was potentially exposed and who's now at risk for transmission of this illness.
But the bottom line is that I believe that there's a fairly large employer in this community that has sent employees home because they were subjected to a training and presence in front of other people in a different state. And so they're being kind of self-quarantined.
Yeah, and so that's what we're asking. Those do not need to be reported to us right now. Every single sick person. What we are concerned about are those that are potentially infected with COVID-19. Those are that are the confirmed cases, and then those that are the exposed individuals.
So those people are only getting tested if they show the symptoms, correct? So just because they were sent home from being in a class somewhere else,
Yes.
we're not just going to test them right
Yes,
off the bat.
exactly.
They
The
have to
quarantine
show symptoms.
is to watch for that 14-day period, and if they develop symptoms, then that's when we will determine if testing is needed at that point.
Because then they would have the nexus with exposure
Yes,
and symptoms,
Yes.
then testing.
yes. And once again, the testing without being symptomatic, as I was talking about before, to just go and test somebody who hasn't developed symptoms, we might get negative test even though they have contracted that virus, but they're not showing it yet. So it hasn't really started to affect the body, and it hasn't started to affect the lungs, so we might get a negative test. So it's not going to do us any good. We've been seeing some, you see negative tests, and then somebody gets sick later on with the illness, and then they test positive. Yes?
I just had a question about the self-quarantine. So,
When you ask questions, can you please introduce yourself? That would be great.
I'm CJ Hansen with Canyonlands Healthcare
Great.
page. If we have staff, like we've got some staff that have been in Washington D.C. recently. We know
Yes.
there are a number of people that have self-quarantined there. I don't know if they've been exposed to the virus.
Yes.
Are you recommending at this point that they self-quarantine until we know for sure?
So right now, we're not recommending just because you've been somewhere where there's transmission. There are excellent contact tracing. There is excellent contact tracing taking place. And we are getting alerted if somebody is a contact of one of those confirmed cases from those areas. You're doing excellent, Tracy. And we're getting alerted. Those places in DC that we've seen have been events. So it's been easy to identify who those contacts are related to those events that we've seen transmission happen. Yes. Supervisor Powell.
You may have read the story about our county supervisor, Coconino County Supervisor Jim Parks, who is in self-quarantine. He has 5 more days, and the reason for that is that Congressman Gozar was at an event in DC, CPAC, and he was in contact with someone who tested positive. And we, from Coconino County Board of Supervisors, we traveled to Washington, D.C., to the Hill and make Hill visits, and we all divide up who we're going to meet with. And Supervisor Parks met with Congressman Gozar, and Gozar was in contact with someone else that was test positive, and so when Jim found out what had happened, he decided he was going to do stay at home just as a precaution. So, I think it's, Matt and the health team said that most likely there's no transmission, but that's where I think that we have to be careful and work. Jim was in direct contact with Congressman Gozar.
Thank you. So to talk about that a little bit, with the lack of evidence, that leaves a lot of open for interpretation, and with what we've been seeing around the world, with the amount of people that get infected, it brings that high level of concern, and people need to be concerned. People need to be aware. And so in the relationships of becoming infected and being a contact, the public health side, they're gonna do their job to go off of the latest science and the latest research that is being done to identify those that are most likely to have been exposed and could have potentially transmitted this illness. Now, on the other side of that, if there's somebody who went to an area and they work in patient care and they are concerned that they might have contracted it, then we're leaving it up to those individuals or those organizations to make that determination. We have a recommendation right now based on the science, but since there is an unknown element regarding the transmission, and we are seeing widespread community transmission in other parts of the world, it's good to be diligent here and take those precautions. But as of right now, from the CDC, it is not a recommendation of somebody who's a contact of a contact to a confirmed case to quarantine themselves. We could possibly get to the point where we quarantine everyone if we're quarantining contacts of contacts of contacts of contacts. So we need to take what is available and at our fingertips and make the best decisions possible for trying to contain this. Now, people need to be responsible and understand, try to understand those details and that evidence that we're putting out there as best they can to make those determinations, especially if you work in a healthcare facility. Does that help answer your question at all? Process as well, so we can talk after this. But if you're not on my email list, because I'm emailing just about every healthcare facility in Coconino County, keeping them updated, communication back and forth. But of course, that list builds with people who are not on that list currently.
Are you wanting all healthcare organizations to be able to do this? Because I said I run a mental health organization, but we have a small primary care.
We have a well, it depends if you have primary care, but we have a separate information strategy for mental health clinics because it's separate from the healthcare facilities. But if you do have a primary care, then we can discuss that.
Okay, thank you.
Yeah. But that's one of our main roles in the second one, is providing information to the public, to the media, to our public health networks, county staff, everyone in the community. We really got on that this week to try to deliver that high quality information, up-to-date information, to try to help get rid of some of the misinformation that is floating around. I spend a lot of my day reading about what is happening, updates, the research, what are the best strategies.
Teresa Lee, by the way. Addressing misinformation. So, of course, rumors are flying up one side and down the other. One of the ones that I have heard recently is that there are certain echelons of society that are immune to this. Is this accurate?
This is a new virus that has not circulated around the community before. We're not seeing any immunity. Those age groups that are we're seeing a lot less illness in are children. Children accounted for only 2% of cases in China, severe cases. So for some reason, and they're conducting the research on that right now, we are not seeing severe or even very much illness within children. But as far as any immunity, working with the researchers, some of the world-class researchers we have in town and at the university, and discussing the immunity aspect, there is no known immunity to this virus. Unless for those that are becoming infected with it right now, but previous to its emergence, I should say. Thank you. And then the last thing that we're doing, which is part of this conversation right now, is preparing our communities for widespread transmission within Arizona and COVID. A little bit about our different teams. We have an investigation and monitoring team. That team is constantly building, and their role is the investigation of potential cases of COVID-19. A potential case, somebody who fits that criteria for testing or we think is highly suspect for this illness, we consider a person under investigation for this illness. So you might hear the term PUI. A PUI is a person who we think is at risk for this illness, and one that is we're going to get tested and work on identifying them as a case or not. That's a PUI. Our Joint Information Center is going to be up and running very shortly. Lots of different partners within that. Lots of different groups, anyone who really needs to be involved with organizing communication and getting communication out. Patient support, we have not yet, this is still planned and prepared. We have not had to initiate this team yet, because we haven't had any confirmed cases. But as we start to get confirmed cases, then those people are going to need a lot of support when it comes to their daily routines of life. Our surveillance. Our EPI team is really leading the surveillance. Surveillance is really tracking and identifying, working with lots of different community groups. Where do we have people coming in from other countries? Working with our partners that are bringing people in, the travel aspects, where are people coming from? Working on identifying the potential cases that are coming into our county. And then a whole lot of other aspects to working with those that were potentially exposed as well. Future planning is continually planning for what's next. And there's lots of different areas to this. You have all the way from, this may not affect us very much, to it may be the worst outbreak movie I've ever seen. Right? Where is it going to fall? Specimen collection, transportation. This team is really getting bulked up right now. There's a lot of fears within the community that because you're sick, you have COVID-19. Right now, we are seeing a lot more illness circulating around our community than COVID-19. A lot more colds and respiratory illnesses. Still a lot of flu circulating around. It is hard because this one does not distinguish itself. But what we can go off of is our surveillance systems, our surveillance capacities to see what is happening within our community related to COVID-19. So far, we haven't found it. It'll get a lot tougher as we do start to find it. Our call center, calls from the public. We're going to direct our calls to experts. So if you're a physician with a PUI, then you're going to get routed to somebody who knows what they're talking about. If you're a member of the public who's sick, then you'll get routed to somebody. If you're a member of the public who's just looking for general information, we're getting lots of calls on a daily basis. It's great. It's great. We want the calls. We're telling people to contact us. And we're setting up call centers to be able to handle the amount of calls. So that way we can get to everybody in a timely manner and get good, accurate, up-to-date information out.
Dave Van Lincoln with Park Service. Is the call center, is that number on your website?
It will be.
Oh,
Yes.
will be?
It will be. Yep. It's going to be the same phone number that we used for H1N1, the swine flu. And we'll get that out there as soon as they're working on just some of the specifics as far as the call handler and seeing who calls are going to, but that should be up and running also
Within a day or so.
within it. Yeah, maybe today. Yeah.
So the call center should be up and running today, and once that's up, we'll be able to get the number out to everyone. Right now, we're trying to internally have staff volunteer to mend those calls and see who's all available and start scheduling to put a schedule together. Once that's all together, then we'll be able to open up the call center. And we'll get the information out to you.
And then just really bulking these things up and getting bodies to fill these positions are the roles that we need. So this is what I was referring to before. Healthcare facilities, providers, healthcare coalition, EMS, medical transportation, emergency management, schools, K through 12 and daycare, long-term care facilities. Long-term care facilities, our most high-risk people right now for severe illness are those 60 or older, as well as those with underlying health conditions. 80% of people who are getting this illness have very mild symptoms. The 15 to 20% that are experiencing severe symptoms are within our 60 and older and those with underlying health conditions. This is a community that we need to protect. Question?
We're constantly hearing underlying health conditions.
Yes.
Can you give examples
Yes.
of that, please?
Yes, so anybody who is experiencing an infection that their immune system is currently responding to something else, and it makes it harder for their body to fight this one off. And so anybody with comorbidities, with chronic illness, cancers, diabetes, those with chronic illness whose body is already working hard to fight something off. Does that help?
It does.
There's a large number of them.
I realize, and I know here in the States we have an above average rate of obesity. Is that a factor as well?
That I have not heard.
Okay. No, I'm just asking because I know
Yeah.
that poses other health issues.
It does, but so if the immune system, if the obesity is causing your immune system to work hard, then that's an issue, and that's what we mean by that, and that's why we say it is because whatever health condition you might have that the immune system is already working to fight makes it harder to fight off another infection.
Okay. Thank you.
Can COVID-19 coexist with the flu?
They can coexist. Yes, great question. We can have co-infection, COVID-19 and the flu. That would be rough.
That would be unlucky, very unlucky.
Yes.
Yes, Joanne doesn't think she was a chief chapter. I'm wondering, what about with like allergies and all? Because that's really out there now.
Yes, there's a lot of allergies out there.
With the COVID-19.
Yeah, and a lot of people are thinking their allergy symptoms are COVID-19. That's a problem that we're having as well.
So it can, maybe, right? We don't know.
It can what?
Coexist with the COVID-19 or not?
Yes, you can have an infection and be experiencing allergies. Yes.
But allergies don't necessarily make you more susceptible to
Yes,
COVID.
thank you for clarifying. Allergies do not do not necessarily make you more susceptible
Except for
to
touching your eyes
infection.
and your face.
Yeah.
Yes.
And having those symptoms does not mean that you are infected with COVID-19.
Well, being over 60, well, we're all out. Well, except for the young ones.
Hey, Matt?
Yes.
Just FYI, and I'm not inviting you guys to this, but you should contact her if you want to get invited to it. I think it's next Thursday, is that right? Next Wednesday or Thursday, I think it's the 19th. Susan Eubanks, the CEO of the hospital, is scheduling a community meeting of people like you all.
Great.
And almost everybody that's on that list, I think she's already got identified. So we can get together as a community and talk about what we're going to do, et cetera,
Great.
et cetera. Also talk about how to.
Let me get her
talk.
information from you too for our liaison team.
Yes.
So that way they can work on identifying outreach strategies for all the groups in the northern region.
Yeah, but if you all in here think you should get invited, if you don't get invited, you need to get a hold of Susan Eubanks and Fort Page Hospital and find out how to get on that list.
What time is this scheduled till? 10:30?
We can go a little bit longer if people
Okay.
have questions.
So our liaison officers for these, Mike Oxenby, Amy Young, they're putting together the team of people that are going to be reaching out and really helping each person. If you don't see your specific organization, you fit somewhere in there. We're identifying basically every community member and organization to try to work on helping you to feel more comfortable with this COVID-19 response and where the risk level's at and what you can do to not only prepare but respond. So how can we prepare as a community? Lots of good information. Our website, the CDC website, on their website they list each of these different organizations and they tell you specifically exactly how you're supposed to do that. And that's information that's going to be delivered to you through our office as well. ADHS has the same thing. ADHS also has a series of webinars that are going on with recorded webinars to specifically provide outreach to each different type of organization. But how can we prepare as a community? So what can we do? All right. Let me find where I'm at. So community-based interventions. We're talking to people about personal protective measures. Personal protective measures include your voluntary home isolation. Isolation is the ill. Quarantine are those that could be exposed. So if somebody is feeling sick and they're not sure what it is, let's talk with their healthcare providers to work on figuring out if we're at risk for COVID-19 or not. And isolating ourselves until our symptoms resolve. That's the nice thing to do. We don't want your illness even if it's not COVID-19. We don't want it. Community does not need it right now. Voluntary home quarantine if you're exposed. So these are the things that the community and members of the community need to be aware of and need to be helping us out in our response to be doing. Expose yourself and household members. Covering your nose, your mouth when you're coughing, sneezing. So those basic prevention messages that we've heard over and over and over again, they work. They're shown to work to prevent the spread of this virus. Washing our hands. I was just reading some research about the virus this morning, and it's talking on a micro level, a very high level, about how it affects your body. And it was talking about how the lipid structure of this virus just disappears with soap. Immediately, gone. Washing your hands, soap and water. If you don't have that available, the recommendation from the CDC is 60% or higher with hand sanitizer. I hear hand sanitizer is just out. The county is making their own because of that, and distributing it out. But soap and water, if you have availability for it. Covering your cough. Avoiding sick people, staying home. These work. Community measures aimed at increased social distancing. You know, NAU did a news broadcast that I was a part of where they just focus on the distance between each other when we're out socially, right? The 3 to 6 feet. Yeah, that'll work. But what we're talking about when it's social distancing, it is legitimately distancing yourself. If you're in a high-risk category, and you should not be getting this illness or underlying health conditions, those where the immune system is already stressed, for a little bit, avoid social gatherings. Avoid going to areas where there's lots of people. Limit your risk of obtaining this infection. We're not asking you right now to change your daily processes, but just alter them a little bit to where you're still doing your daily routines, but just in a way that helps out with the basic sanitation, your basic avoidance of large community gatherings. We are also not asking people to cancel events at this time, but we're having those discussions. Anybody that is having an event, we're talking with the event coordinators, we're assessing the risk, we're determining where people are coming from. It's case-by-case basis. People are canceling events right now, but where we're seeing our risk at currently, we're not saying you have to. We're just saying to think about it. Have an idea of what is my event, where is it? And then our environmental measures. And these really have to do with adequate and good cleaning. Bleach solutions, not jugs of bleach going everywhere, but our 10% bleach solutions. 1 part bleach to 9 parts water. Works just fine. Don't need to overdo it. Sanitizer wipes. A lot of the wipes will say on them, coronaviruses. They're killed off fairly easily. Viruses in general. Yes?
Will cleaners aimed more at bloodborne pathogens work?
For the most part, yes, but I can't give you a blanket answer on that.
Okay. So generally, yes.
Generally, yes. So in preparing our community, I've talked quite a bit about our incident command team. I don't think we need that. But since we don't have right now, there are no vaccinations. There is not a vaccination available. There's not a medical treatment. So we focus on our non-pharmaceutical interventions, those that are not a medical treatment. If somebody is sick with this, it's supporting them so their body can fight off the illness within a medical setting. And from there, it's isolation of our ill, quarantining of our exposed, our social distancing, staying away. These are what is shown to work to contain and prevent the spread of this virus. And we are going to hopefully succeed as a community in limiting the spread of this virus. It's on all of us to do so. And public messaging surrounding good, up-to-date, adequate information. We're really working hard, our incident management team, to identify resource shortages. So let us know. We're going to work with the liaisons, work with those that are responding to really know what are the resources that you need. I already sent out a survey to all of our providers, and I'm adding more on the list each day to assess what do you need. What are your needs? We have emergency declaration now. We're going to get it. Just ask. Please ask. And if we can't get it, we're going to figure out a way to get it. We're going to try. I've talked about community surge. If and when this thing increases, we have a whole team of people working on worst case scenario, and we're looking at other communities. What did other communities do well? What did other communities do poorly? We have some evidence now behind places that have already seen widespread transmission, how they responded to it, and what worked and what didn't work. And what's been seen to work are our basic strategies. I call them basic, they're not that basic, but our public health intervention disease containment strategies have worked. The World Health Organization, after going into China, has said that some of those outlandish shut it all down strategies are a bit unnecessary. Draconian is what they refer to them. Draconian methods, just over the top, are showing to be unnecessary in areas where we've seen widespread transmission. But our containment strategies, the guidance from the CDC, the guidance from the state, are working. Strategic National Stockpile, medical countermeasures, this is just information about ICS stuff. These are just outlets for us to be able to work on providing, to get the community the needs that they have. So what can your organization do? We put on, really plan and prepare. What does it look like for your organization? We're going to help you in this process. And if you do have any cases, we are going to be there. We are coming in. We're doing our investigation. We're isolating and quarantining. But what can you do to plan and prepare for widespread transmission? What does that look like at your organization? Can people not come in and work remotely? Is that possible for your organizations? Some organizations, yes. Some organizations, no. As it was alluded to earlier, those in the healthcare world, you're working. You're up and running. You're partners in this. You're our partners in this. You're helping us to identify these cases. Unless you get exposed and need to be quarantined. And that's what we've been seeing. First responders on the front line of this thing. We've been seeing from some of the initial cases that 20 to 30 first responders having to be quarantined. So take those precautions, use those precautions. ADHS right now, standard precautions, direct contact precautions. They got rid of the airborne. CDC still has the airborne precautions. But as I said before, masking your patient, masking yourself, transporting them in. It is hard, though, to go on a call and know, does this person have a respiratory illness, until you start talking to them a little bit. So working on those flow charts, so that way you can get a better idea of the type of call that you're going on as far as illness goes. And we can work together in that and obtain those flow charts, working with healthcare facilities or the triage of their individuals. Review and evaluate your business operations. This is what we were talking about. That's what I was talking about already. Really building up that capacity for employees staying home when they're sick. For a little bit of time here, we're in the midst of a pandemic, a global pandemic, one that I don't know that any of us has seen in our lifetime. We're going to have to do some strategies. We're going to have to operate some strategies around sick people and giving them a chance to stay home that we haven't seen. Changing service delivery, and then our continuity of operations, working with your emergency managers to focus on those, what does your continuity of operations look like? And then also along those lines, communicate with the county. Like I said, we had those liaisons that we picked up for each area. And we're going to be really providing a lot of outreach, getting a lot of feedback on what are the concerns, what do you need to know. Talked about that already. And then these are those prevention messages that we're seeing work. Staying home when you're sick, avoid touching your eyes, your nose, your mouth. These are the areas that the virus can get into your system. Avoid close contact with people who are sick. Clean and disinfect surfaces. Cover your cough. Washing your hands. Let's plan ahead. Let's be ready. Right now, like I said, that risk is low. We're preparing for widespread transmission. We're searching on identifying it. And that's what I have for you today. So I appreciate your time. And we did a question and answer while this was happening, but I'll be glad to take any more questions.
I don't know if you know yet, but do you know what the long-term strategy is going to be? I know they're working on vaccination. Is that?
Yep. Vaccinations are being worked on, and the estimations for that are 12 to 18 months about, but no definite time frame for that as far as the pharmaceutical interventions. And then treatment is also being worked on currently as well. But I don't have any specifics on timeline. Thank you. Yes?
We're already running into a problem with distributors
Yes.
getting certain things in. Is there a plan somewhere to see if, again, somebody of a higher authority can purchase